Assalamu alaikum. Good morning or good afternoon now. So a small talk about predictive height gain in AIS surgery. This is a research that we have done at our unit. So as everybody knows, AIS is a 3D planar deformity. So we have the coronal curve, the sagittal apical lordosis, and the axial deformity. And we have to spend a lot of time counseling AIS patients, explaining to them what will happen and the process. And there is a height loss that is quite anticipated with the spinal deformity. So if you can imagine a patient with normal spine and a similar patient with a curved spine, there will be a height loss. And that height loss will increase as much as the deformity will increase as well. Also, there is the height loss related to the fusion surgery itself. So if you look at this 14-year-old female patient that had gone a very well done corrective surgery, based on the literature, we know that each level grow about 0.7 millimeter per year. So by that calculation, this patient has lost almost 2 centimeters of potential growth over the coming 2 years. And then I'm going to speak about the ratio between the height and the arm span. So in normal population, the normal ratio is around 1. So in any given person, usually the arm span, which is the distance between the tip of the middle fingers outstretched, and the height should be around the same number as the height. So height is a concern to these patients. It's concerned with how much height they're going to gain, how much height they're going to lose as well. And it is also known that AIS patients have abnormal anthropometric measurements as well. And it's not only the height they lose that we think about, it's also the height they will gain. As an example, this is a patient that had a severe spinal deformity that we were able to correct very nicely, but she gained almost 10 centimeters of height immediately post-operative. She was already a very tall girl, and then she gained an extra 10 centimeters. She was happy with the surgery, but she was not happy at how much tall she is now. So it's something that we need to counsel our patients on. So the aim of our study was to quantify the predictive height gain in AIS patient surgery for proper preoperative patient counseling and expectation setting. This is a retrospective study of prospectively collected data. So our inclusion criteria were patients AIS only, aged between 11 to 19, posterior correction and fusion, all pedicle screws construct. Our exclusion criteria were previous spine surgery, other comorbidities, incomplete radiological data, or if the patient had an anterior surgery. So we're able to include 51 patients, about 36 were females, 15 males. Their mean age was about 14.3. Most of them were linked type 1, 21 of them, and the rest of the types were equally distributed apart from link 5. Comparing the preoperative to postoperative results, we're able to get about 65% of correction of the main thoracic curve, similar to the thoracolumbar curve, and around 42% of correction into the proximal curve. The height gained through this surgery was almost a mean of 4 centimeter mean for all patients. So the preoperative height was about 157, reached to about 162.2. And how does the height versus arm span plays into role in this? So preoperatively, there was about 4 centimeter difference average between the arm span and the height of the patient, and that difference was normalized with surgery. So what we are able to predict from the surgery that the height of the patient compared to the arm span was normalized with surgery. So we concluded that in AIS surgery, achieving about 60 to 70% of correction will allow normalization of the arm span height ratio. The predictive height gain with AIS surgery will be around the difference preoperatively from the height and the arm span. Thank you.